This is Jenny Rayner. I would like to introduce Barbara Altieri, who is an associate professor of endocrinology at the University of Parma, Italy, and the head of adrenocortical carcinoma working group within the European Network for the Study of Adrenal Tumors. She previously worked as a clinical scientist at the University Hospital of Würzburg in Germany. Her research focuses on adrenal tumors, especially ACC, with an emphasis on understanding tumor biology, identifying biomarkers, and exploring new treatments. She is active in Cushing syndrome research. Barbara has authored over 100 scientific publications and received multiple international awards for her work. Alongside her scientific work, Barbara is committed to mentoring young researchers and has served on the European Society of Endocrinology's Committee for Young Endocrinologists and Scientists. Welcome, Barbara.
So thank you very much for the nice introduction and thanks for inviting me today. I will talk on the effect of Mitotane and the managing of its side effects. And I would like to start with a simple question for all of you and invited you to answer to this. Just remember that there is no wrong answer. We would like just to know your experience. So my question is, if you ever been on Mitotane treatment as part of your treatment? Please answer yes or no. We'll give you some time. Wait for the answers. Okay, so the answer, so 52% of you had Mitotane treatment. So let's say most of you were under Mitotane. And why Mitotane? Why we start with Mitotane? So the first important evidence came from this study from 2007, where it has been shown that patients under Mitotane have a longer time to recurrence, as we can see here underlined in red, compared to different control groups. And these results were confirmed by different following studies that shows a benefit of Mitotane both in terms of recurrence-free or overall survival. And as we heard before, Mitotane is used as monotherapy also in advanced stages. And these studies by the Würzburg group show that more than 20% of patients experience a long-term disease control at 1 year. But who benefit most? The same study demonstrated that patients with low tumor burden, including, so that's meaning patients with a low number of metastases and small metastases, may benefit most from this treatment. And also, as we already heard from the previous presentation, very recently, the ADUVO study also demonstrated that Mitotane is not necessary in patients at low risk of recurrence. So meaning with patients with stage 1 to 3, complete tumor resection and Ki-60% below 10%. But why this study is important? Because Mitotane is associated with several side effects. We can see some of them here represented in these cartoons. Therefore, we can avoid unnecessary toxicity in those patients who are at low risk of recurrence, avoid Mitotane treatment. And this is very important. And to better describe the adverse events associated to Mitotane, we started some years ago a multicenter study across Europe and US, including more than 500 medical records, where we collected more than 5,000 adverse events. And this is meaning that each patient experienced a median number of 10 different adverse events, which, if we can think about, this is a very high number of adverse events. But what are those adverse events? Most patients, more than around 19% of them, experience at least one gastrointestinal and general side effects, including diarrhea in 40-60% of cases, nausea in 57% of cases, vomiting and weight loss in around 30%, and weakness in around 70% of cases. Also, neurological adverse events were common and were reported in almost 60% of patients. Among the others, the most frequent were concentration impairment and vertigo, which were reported in around 30% of cases. But importantly, all these cases were grade from 1 to 3. We don't have grade 4, so meaning that we don't have strong adverse events. We also observed laboratory changes and alteration of liver enzyme were very frequently reported in almost all of cases. We also found alteration in blood cell counts with leukopenia in 50% of these cases, but also very common were the increase of cholesterol and triglyceride levels, which were observed in 73 and 46% of cases respectively. And particularly, 44% of cases with high cholesterol levels were treated with statins, and among which 29 were new started of treatment. And 80% of cases with high triglyceride levels were treated with the fenofibrate, including 7% of new start. And I would like to ask you, to all of you, if during the Mitotane treatment, did you start the levothyroxine supplementation treatment? Please answer yes or no, and I give you some time. So we wait for the answer. Okay, so 35% of cases need levothyroxine supplementation. And so this is what it has been reported in the literature. So it's your experience. In this study by the Turin group, they reported low levels of FT4, but not TSH, during the Mitotane treatment. And 36% of patients needed supplementation with levothyroxine. And similar results were also found in our cohort, so 35%, which is exactly what you answered now. So this is meaning that 1/3 of the cases needed also supplementation with thyroid hormones. And there is another question for you. Have you ever started glucocorticoid replacement therapy, such as hydrocortisone, while on Mitotane treatment? Please answer yes or no. Again, there's no wrong answer. So we wait for the results and wait for your experience. Just another few time. Okay, so 78% of you answered yes, so they need hydrocortisone replacement treatment, and 22% of you answered no. So these results, it's not surprising because virtually all patients under Mitotane suffer from adrenal insufficiency and need glucocorticoid replacement therapy, and often with a high doses of 50 milligram daily or even more of hydrocortisone due to the interaction of Mitotane. And that is why it's important for all of patients to have and always bring with them the adrenal emergency card that you can download from the ECE website. There is translation in several languages, so you can find also your own language. And you can also download from the ECE website the brochure of glucocorticoid treatment, where you can find important information of glucocorticoid replacement therapy. So please copy these two links and download all these informations. I'm also have another question for you. And for those patients who stop the Mitotane, did you also stop taking glucocorticoid replacement therapy such as hydrocortisone after the stop of Mitotane? Please answer yes or no. Just give you some time. So 16% of you answered yes, so stopped also the glucocorticoid replacement treatment, and 83% answered no. This is an interesting result, so interesting experience from you. Because what happened after that we stop the Mitotane? After the treatment discontinuation, the adrenal gland could start to recover the normal cortisol production and its normal function. What this means? That patient could stop the glucocorticoid replacement therapy after the discontinuation of Mitotane. And we recently observed that 57% of patients, those reporting with the blue color, stopped the glucocorticoid replacement therapy after the Mitotane discontinuation. And this happened after a median time of 26 months after the Mitotane stop. So it is important to test the adrenal function after the stop of Mitotane, even also after a couple of years after the stop of Mitotane, because the adrenal could recover its function. And this is very important for you to improve the quality of life of our patient. So, to conclude, Mitotane is effective for the treatment of ACC, but the adjuvant use it's not needed for low-risk patients, and the restoration of adrenal function after Mitotane discontinuation is possible. And particularly those last 2 points are very important for the improvement and the quality of life of our patients. And I want to thank you for your attention, all the patient supporting group, the European Society of Endocrinology, and please do not hesitate to contact me if you have other further questions.
Thank you very much, Barbara, for this very nice overview on mitotane treatment. And to the audience, please put your questions in the Q&A part, so then we can discuss all your questions afterward.